Thank you, Mr. Chair. I may come back to Blue Water just because Commander Wells is from Louisiana. Very proud of him. Also very proud of my chairman for how he's handling this. So thank you both for bringing great consideration. I'll briefly mention, by the way, my Modernization of Medical Records Access for Veterans Act, which I understand the VA has opposition to a pilot program, but I will follow up on that at a later point because I want to focus on our suicide prevention. I noted, Dr. Lawrence, that the VA is in support. Thank you very much. That said, I understand there's both internal and external potential opposition to it, and so I'd just like to make the case for my colleagues and hopefully for those who might not be sure about the bill. And just to put this in perspective, when Dr. Lawrence came for his nomination, we spoke about suicide prevention and veteran community. We know that there are socioeconomic risk factors in addition to mental health issues associated with suicide. And we've spoken previously about so-called deaths of despair. Can you put that up? We find out of data from Princeton using CDC data that suicide, alcohol abuse, and drug abuse are in this unholy trinity, which results in folks being at increased risk for support. And by the way, CDC notes that 54% of suicides have no known mental health condition. The socioeconomic factors, particularly isolation, should be part of our approach. And here's the next put up by my assistant. Again, social isolation, foreclosure, life events, addiction only being one of them, can be associated with so-called deaths of despair. So the community grant program that we are suggesting would coordinate services within the community, helping veterans by integrating and strengthening social networks. I smile. My daughter thinks of a social network as being Facebook. I don't think that most folks my age would consider such. So the grant, by the way, is also about reaching the 70% of veterans who don't seek care in a VA facility. So 70% of veterans who die by suicide have not been seen within a VA in the past 12 months. And we think this is an incredibly important statistic, and if you will, a vulnerability upon relying on a VA hospital-centric approach. So, Dr. Lawrence, then you enter. We're interested in kind of a different paradigm. How could we use the Veterans Benefits Administration, which is for many the gateway to the VA? More veterans access VA benefits than health care. And in many cases, that might be their only connection. I note that we talked about a VA loan program for homes. That is one way a veteran who's probably a little bit better off might interact with the VA, but she or he might never interact with the hospital. So we're trying to think of that. And the other thing, and I think we spoke about this before, the Transition Assistance Program legislation, which establishes a governance board to, in this legislation to address deaths of despair within the Benefits Administration. If you will, breaking down the silos within the VA, leveraging all the resources, not just the hospital system, but also VBA in a department-wide suicide prevention effort. I say that, again, our previous conversation, the first 3 years after leaving service are when veterans are at the highest risk of suicide, which is why the Transition Assistance Program is a critical partner in our suicide prevention effort. So the Community Grant Program will augment the VA's efforts in seeking out veterans in need and connecting them to the VA and community services and benefits. So defeating deaths of despair requires that we take a comprehensive approach to reaching vulnerable veterans, and that's why we want VBA. Dr. Lawrence, we spoke about VBA's role in suicide prevention during your confirmation hearing. Since then, and knowing that you've looked at the bill we proposed, can you give your thoughts on how you, the VBA, can support this effort and place in the governance board within benefits to ensure suicide prevention is a department-wide effort?
Certainly, and I want you to know I took seriously our conversation on April 12th, and one of the first things I did when I was confirmed was begin to understand what's the relationship, as you point out, with the despair. And so VA has a series of counselors called VOC rehab counselors that deal with vocational rehabilitation. They begin the engagement you actually were describing with veterans. And one of the things I learned from reports GAO watching the House hearings was the ratio of service members to counselors was above the ratio prescribed by law. It's supposed to be 125 to 1. It was north of 140. The first thing I immediately did was figure out how to streamline staffing to go and hire more of these counselors. So by the end of this fiscal year, a couple months, we'll have enough counselors on board so that ratio is in compliance with the law. And we completely agree with you. I completely agree with you that the engagement is critical. And part of what these counselors do is exactly what the second slide, what do you need from us? Is it a benefits? Perhaps you're homeless, and we can expedite your claim. Perhaps you need medical attention, and we connect you at VA. So I totally took our conversation seriously, and it had an impact on my actions in the first less than 100 days. The second thing, as you know, is transition assistance is actually led by the Department of Defense and Department of Labor. We work with them. So, I'd like to say we've reignited, but I don't think it needed that much igniting, engaging with them to really work these issues. We are conducting a survey. It's now sitting with OMB, so we can do that, to analyze service members who are now veterans who have gone through TAP afterwards. We get a very good survey while it goes on, but sometimes we wonder if they don't know what they don't know. We want to talk to them afterwards and reflect on, now that you've had a job and you've begun your life again, how did we do getting you ready? So we are very much in agreement with you. In fact, what we think about at VA is, you're a member of the military for a short period of time, in my case 3 years, but you're a veteran forever. We have a longer relationship with you that we need to think about how it's maintained and continued.
Well, thank you very much, and I appreciate you all looking at this, and I look forward to its passage and urge my colleagues to support when the time arises. Thank you.